Have you ever experienced unusual changes in your legs or feet? Persistent swelling that doesn't go away, unexplained pain or cramping, changes in skin color, or even a tingling or numb sensation, and wondered if they could mean something more serious? While these symptoms might seem minor or easy to dismiss, doctors warn they could be early signs of a hidden and potentially life-threatening issue, including certain types of cancer. Understanding your body's signals is crucial, and this video will guide you through the 4 key abnormalities in your legs and feet that you should never ignore. By paying attention to these often overlooked symptoms, you can take charge of your health and potentially catch serious problems early. Make sure to watch until the end, because we'll not only explain these warning signs but also share why they happen, how they might be connected to cancer, and what steps you can take to seek the right care. The information in this video could make all the difference in protecting your health, or even saving your life. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. 1. Persistent swelling in the legs or feet. Chronic swelling in the legs or feet, medically known as lymphedema, is a condition that arises when the lymphatic system, responsible for maintaining fluid balance and supporting immune function, is disrupted. This disruption prevents lymph fluid from draining properly, leading to its accumulation in the tissues. The result is noticeable swelling, which can range from mild to severe, depending on the extent of the blockage or damage. Lymphedema often manifests as a tight, heavy sensation in the affected area, and the skin may feel stretched or firm to the touch. In more advanced cases, the swelling can lead to significant discomfort, reduced range of motion, and challenges in performing everyday activities. The affected limb might appear disproportionately larger than the other, and the skin can become more vulnerable to infections, such as cellulitis, due to compromised circulation. This condition can be caused by a variety of factors, including damage to or removal of lymph nodes, which often occurs during cancer treatments like surgery or radiation therapy. Certain cancers, such as lymphoma, can directly affect the lymphatic system, causing blockages that lead to swelling. Additionally, chemotherapy drugs may weaken lymphatic structures, further contributing to fluid buildup. It's important to note that while some swelling can result from temporary issues, such as prolonged sitting or standing, lymphedema is typically chronic and progressive if left untreated. Symptoms may worsen over time, leading to increased discomfort and complications. If you notice persistent swelling that does not improve with rest or lifestyle adjustments, or if it occurs without an obvious cause, seeking medical attention promptly is crucial. Early diagnosis and intervention can help manage symptoms and prevent further progression. Treatment may involve compression therapy, physical therapy, manual lymphatic drainage, and in some cases, surgical options to restore fluid balance. Paying close attention to changes in your body and addressing them with a healthcare provider can improve outcomes and help maintain your quality of life. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 2. Unexplained pain or cramping. Unexplained aches, pains, or muscle cramps in the legs or feet that appear suddenly and persist without any apparent reason, such as physical activity, exertion, or injury, can often be a warning sign of a serious underlying condition. While most people experience occasional muscle cramps after a long day of activity or due to dehydration, pain that is not linked to any specific cause, especially when it occurs frequently or persists for extended periods, should not be dismissed. These symptoms could be a red flag indicating the presence of a blood clot, which can be a severe and potentially life-threatening health issue. For individuals with cancer, the risk of developing blood clots is notably higher. This heightened risk is associated with a condition called hypercoagulability, in which the body is more prone to form blood clots. Cancer itself can contribute to this increased clotting tendency in several ways. The cancer cells can release proteins that trigger clot formation, and certain treatments, such as chemotherapy, can also cause changes in the blood's clotting mechanisms. Additionally, cancer-related factors such as immobility during treatment or surgery, tumor growth, or even certain medications can exacerbate the likelihood of clot formation in the veins. One of the most common types of blood clots to watch for is deep vein thrombosis, DVT, which typically occurs in the deep veins of the legs. DVT often presents as persistent pain, tenderness, swelling, redness, or a feeling of warmth in the affected leg or foot. The pain may feel like a dull ache or a sharp cramp and may worsen with movement or standing for prolonged periods. In some cases, DVT can also cause visible swelling or a sense of heaviness in the leg. This discomfort can sometimes be mistaken for general muscle soreness or fatigue, which is why it's important to be vigilant and seek medical attention if such symptoms occur without a clear cause. When blood clots form in the veins, they can obstruct the flow of blood, which can lead to further complications if left untreated. The most serious risk associated with DVT is when a clot breaks loose and travels through the bloodstream. If the clot reaches the lungs, it can block a pulmonary artery, resulting in a pulmonary embolism, PE. This condition is a medical emergency that requires immediate attention, as it can cause severe complications such as sudden shortness of breath, chest pain, rapid heart rate, dizziness, or even collapse. In some cases, pulmonary embolism can be fatal if not quickly diagnosed and treated. The danger of DVT and PE is that they may not always be immediately obvious, and the symptoms can develop gradually or be mistaken for less severe issues. For example, many people with cancer may assume that their leg pain is simply due to the side effects of treatment, like fatigue or muscle strain. However, unexplained or persistent pain, particularly in the lower extremities, should always be evaluated by a healthcare professional. Diagnostic tests such as ultrasounds or blood tests can confirm the presence of a clot, allowing for early intervention and treatment. If you experience persistent pain, swelling, or discomfort in the legs or feet, especially if you have a history of cancer or are undergoing cancer treatment, it's important to seek medical attention promptly. Early detection of blood clots can greatly reduce the risk of severe complications, including the potential for a pulmonary embolism. Treatment may involve medications such as blood thinners to prevent the clot from growing or spreading, and in some cases, procedures to physically remove the clot may be required. In any case, unexplained pain should never be ignored, as taking action quickly can help protect your health and reduce the risk of life-threatening complications. 3. Changes in skin appearance. Changes in the skin's appearance can often serve as an early warning sign of serious health issues, including certain types of cancers, circulatory problems, and other systemic conditions. It is crucial to pay close attention to discoloration, sores that do not heal, or unusual rashes, especially on areas like the legs, feet, and extremities. These changes can indicate underlying medical issues that may require immediate attention and intervention. The skin, as the body's largest organ, often reflects internal health, and alterations in its appearance should never be overlooked. For instance, melanomas, a particularly aggressive form of skin cancer, can sometimes develop on the feet or legs. These melanomas are especially insidious because their appearance is often subtle, and they can go unnoticed for long periods due to their location in less visible areas. The feet, in particular, are frequently ignored when it comes to self-examination, allowing the melanoma to progress unnoticed until it reaches a more advanced and potentially life-threatening stage. Melanomas typically appear as irregularly shaped, discolored moles or spots with varying colors, including shades of brown, black, red, blue, or even white. Any changes in the size, shape, or color of existing moles or the development of new ones should be investigated promptly by a healthcare provider. It's essential to be vigilant about performing regular skin checks, especially in hard-to-see areas like the soles of the feet and between the toes. In addition to melanomas, other forms of cancer, particularly those affecting the organs responsible for blood circulation such as the lungs, liver, pancreas, or kidneys, can lead to compromised circulation and subsequent changes in skin appearance. Poor circulation, often resulting from tumors pressing on blood vessels or impairing normal blood flow, can lead to noticeable skin discolorations, particularly in the extremities. Reddish, bluish, or purplish skin tones in the legs, feet, or even hands may indicate that blood is not circulating properly, resulting in insufficient oxygen being delivered to these areas. This discoloration can occur because the blood is pooling in certain regions, leading to a buildup of deoxygenated blood, which causes the skin to appear darker or more flushed than usual. In some cases, the skin may even feel cold or numb, which is another symptom of inadequate circulation. Circulatory issues caused by cancer or other conditions can also lead to cold extremities, particularly in the hands and feet. This can happen when the blood vessels are unable to deliver adequate blood flow to these areas, either due to external pressure from tumors or the body's weakened ability to circulate blood effectively. When combined with discoloration, cold extremities can indicate a deeper, systemic problem that may require immediate medical attention. Other circulatory problems, such as venous insufficiency or peripheral artery disease, PAD, can also cause the skin to appear discolored, especially in the legs. In venous insufficiency, the veins are unable to efficiently return blood to the heart, leading to blood pooling in the lower limbs. This can cause redness, swelling, or a bluish hue to the skin, which may become increasingly prominent with prolonged standing or walking. In some cases, chronic wounds or sores that do not heal on the legs or feet can be a significant warning sign. When combined with discoloration, these non-healing sores can indicate poor circulation or, in more severe cases, advanced cancer. Skin ulcers that refuse to heal may occur when there isn't enough blood flow to the affected area to promote healing. For example, cancers that affect the blood vessels or lymphatic system may prevent nutrients and oxygen from reaching damaged tissues, leading to slow or stalled healing processes. Non-healing sores, especially those that develop on the feet or legs, should always be examined by a healthcare professional, as they may indicate a deeper underlying problem, whether related to cancer, vascular health, or another serious condition. Ulcers, sores, or rashes that do not heal promptly can also be symptomatic of systemic issues such as diabetes, autoimmune diseases, or infections. However, when these changes occur alongside symptoms like discoloration, coldness, or a feeling of numbness, they may point to circulatory or oncological concerns. Numbness or tingling sensations in the affected area can also indicate nerve involvement, further complicating the health picture. These symptoms should never be ignored, as they may signal a more urgent medical need. Additionally, rashes that are unusual in appearance or persistent without explanation should be carefully monitored, particularly if they are accompanied by other systemic signs like fever, weight loss, or fatigue. Vigilantly monitoring changes in the skin is essential for early detection of potentially serious conditions. Keeping an eye on skin changes like discoloration, sores that do not heal, or any unusual rashes can make a significant difference in identifying health problems early. When changes are noticed, seeking prompt medical advice or treatment can improve the chances of successful intervention, whether for cancer, circulatory issues, or other health concerns. Early detection is key in minimizing the impact of many serious diseases, and timely medical intervention can significantly improve outcomes and quality of life. By maintaining awareness of these skin changes and understanding their potential link to underlying health issues, individuals can take proactive steps to safeguard their well-being. Whether through regular self-exams, consultations with healthcare providers, or seeking advice at the earliest sign of change, addressing skin issues promptly can lead to better management and prevention of more serious conditions in the future. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 4. Numbness or tingling sensations. Numbness, tingling, or a pins and needles sensation, particularly in the legs and feet, are common signs of neuropathy, a condition where nerve function is disrupted or damaged. Neuropathy can arise as a direct result of cancer itself or as a consequence of cancer treatments, particularly chemotherapy. The sensation of numbness or tingling, known medically as paresthesia, occurs when nerves in the affected area fail to transmit normal sensory signals to the brain, resulting in feelings of reduced sensation, abnormal tingling, or a feeling of walking on pins and needles. These sensations may begin in the extremities, such as the fingers, toes, legs, or hands, and in some cases, they can gradually spread to other areas of the body. One potential cause of neuropathy in cancer patients is the pressure exerted by a tumor on surrounding nerves. As tumors grow, they can press against nerves in the body, interrupting their normal function. When the nerves that control sensation and motor function are compressed, it can lead to the development of numbness or tingling. In addition, if the tumor is located near the spine or brain, the resulting symptoms may affect larger areas of the body or have a more widespread impact. Another significant cause of neuropathy in cancer patients is chemotherapy-induced peripheral neuropathy, CIPN, which occurs as a result of chemotherapy drugs used to treat the cancer. Certain chemotherapy medications, particularly those that target rapidly dividing cells, can also damage healthy nerve tissues, especially in the peripheral nervous system, the network of nerves outside of the brain and spinal cord. This damage can cause persistent sensations of numbness, tingling, or burning in the hands and feet, often starting at the fingertips and toes and potentially spreading upward toward the arms or legs. Over time, the nerve damage may worsen, resulting in additional symptoms such as pain, weakness, or a reduced ability to feel temperature changes, which can pose safety risks. For cancer patients undergoing chemotherapy, the effects of CIPN can be particularly distressing. The symptoms may be debilitating, leading to a significant decline in quality of life. Beyond discomfort, nerve damage from neuropathy can severely affect balance, coordination, and mobility. Walking may become difficult, and patients may feel unsteady or prone to falls. In severe cases, the loss of sensation may impair one's ability to perform basic tasks like buttoning a shirt, holding a cup, or walking without support. This loss of motor control can be frustrating and disheartening, as it often limits an individual's independence and daily functioning. In some cases, neuropathy symptoms may appear suddenly, while in others, they develop gradually over time. The severity of these symptoms can vary greatly, ranging from mild tingling sensations to more intense, constant pain and discomfort. In either case, patients need to seek medical advice if they experience any form of numbness, tingling, or altered sensations. These symptoms should not be ignored, as they may be indicative of nerve damage that requires intervention. Early recognition and treatment are crucial in managing the progression of the condition and minimizing further complications. Treatment options for neuropathy depend on the underlying cause. For patients with cancer-related neuropathy, the approach may include a combination of pain management strategies, physical therapy, and lifestyle adjustments. Pain medications, such as anticonvulsants or antidepressants, may be prescribed to help alleviate the discomfort associated with neuropathy. In cases where chemotherapy-induced neuropathy is the cause, oncologists may modify the chemotherapy regimen, reduce dosages, or switch to alternative treatments to prevent further nerve damage. Physical therapy can also play a critical role in improving balance, strength, and mobility, helping patients regain independence and prevent falls. For some, complementary therapies such as acupuncture or massage therapy may provide relief, but these should always be discussed with a healthcare provider. Additionally, patients experiencing neuropathy may benefit from using assistive devices, such as walking aids, to improve stability and prevent falls. Regular monitoring of symptoms and close communication with healthcare professionals are key components of managing neuropathy effectively. Depending on the severity of symptoms, additional interventions like occupational therapy, which focuses on improving the ability to perform daily tasks, may also be recommended. When to seek medical attention. While symptoms such as numbness, tingling, or unexplained discomfort can result from a wide variety of non-cancerous conditions, they should never be dismissed, especially if they persist, worsen, or occur alongside other troubling signs. It is essential to recognize that certain symptoms, while common, could signal a more serious underlying issue, such as cancer or complications from cancer treatment. For example, persistent numbness or tingling sensations, particularly if they become more frequent or severe over time, may indicate nerve damage or disruption that requires immediate attention. If these sensations are accompanied by additional symptoms such as unexplained weight loss, fatigue, weakness, or changes in bowel or bladder function, it is crucial to seek medical evaluation right away. Consulting a healthcare provider as soon as these symptoms arise is key to determining their cause and ruling out more serious conditions. A doctor can conduct a thorough evaluation, which may include a physical examination, lab tests, imaging scans, or nerve function tests, to pinpoint the source of the symptoms and assess whether they may be related to cancer or its treatments. Early detection of any potential health issue, including cancer, significantly increases the chances of effective treatment and successful outcomes. The earlier the cancer is identified, the more options are available for treatment, and the more manageable the condition may become. In particular, if symptoms worsen suddenly or without clear explanation, or if they do not improve with time or conservative treatment, it is vital to seek medical advice promptly. These symptoms, especially when they develop or change over a short period, may be a sign of cancer progression, nerve damage, or a serious side effect from cancer treatments such as chemotherapy. Additionally, persistent tingling or numbness, if left untreated, could lead to permanent nerve damage or other complications that impact a person's quality of life and daily functioning. Ultimately, staying proactive about health concerns and addressing symptoms early is crucial in achieving the best possible outcome. If in doubt, it is always safer to seek medical attention sooner rather than later. Doing so allows for a timely diagnosis, early intervention, and the development of a treatment plan tailored to the individual's needs. Early detection is often one of the most effective tools in combating cancer and improving long-term prognosis, providing individuals with a better chance to manage their health and recovery successfully. By being proactive and attentive to unusual changes in your body, you empower yourself to take control of your health and well-being. Thank you for watching. What have you learned so far about the warning signs in your legs and feet that could indicate a serious health issue? Let us know in the comments below. Share one thing you've learned today and how you plan to bring it into practice in your life. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel. Your support helps us continue bringing you valuable health insights. Stay proactive about your health, and we'll see you in the next video.